How does speech perception improve with a cochlear implant? Imagine hearing speech clearly even in a noisy room. That's what a cochlear implant can help achieve. This device works by bypassing damaged parts of the inner ear and directly stimulating the auditory nerve with tiny electrical signals. When sound enters the device, it converts the sound waves into electrical impulses that send signals straight to the nerve fibers inside the cochlea. This process restores the pathway for hearing, allowing the brain to receive and interpret speech sounds more effectively. Many people with severe or profound sensorineural hearing loss notice a big difference after getting a cochlear implant. They often see improvements in how well they recognize words, both in quiet settings and in noisy environments. For example, research shows that within a few months of activation, adults can improve their word recognition scores by around 29 percentage points in quiet and 22 points in noisy situations. These gains tend to continue for up to a year before stabilizing, especially with ongoing auditory training and speech therapy. Another key factor in improving speech perception is reducing channel interaction. The implant has multiple electrodes along the cochlea that stimulate different frequency channels. When programming the device, audiologists work to minimize overlap between these channels, which helps the brain distinguish speech sounds more clearly. This fine-tuning makes a big difference in how natural and understandable speech sounds. The brain's ability to adapt, known as neural plasticity, also plays a crucial role. Younger individuals and those who receive early implantation often experience better outcomes because their brains are more adaptable. Post-implantation auditory training and speech therapy help the brain learn to interpret the electrical signals as meaningful speech. For people who lost their hearing later in life, significant improvements are still possible, although results can vary based on individual factors like age and duration of deafness. Beyond just understanding speech, cochlear implants can improve other hearing functions, such as localizing where sounds are coming from and reducing tinnitus, which is the perception of ringing in the ears. Many users find that combining a cochlear implant with a hearing aid in the opposite ear, called bimodal hearing, enhances their ability to hear in complex environments and makes conversations feel more natural. This combination supports better social interactions and overall quality of life. In summary, cochlear implants improve speech perception by electrically stimulating the auditory nerve, which helps the brain process speech signals more clearly. The success of this process depends on proper device programming, effective rehabilitation, and the brain's ability to adapt. These improvements can make a real difference in communication and daily life. It's always important to work closely with healthcare professionals to tailor the approach to each individual's needs, ensuring the best possible outcome.